Built by the Catholic missionaries in Dzodze, the Ketu North municipal capital in the Volta region of Ghana, West Africa, the St. Anthony's Hospital is one of the oldest. The St. Anthony's Hospital is the only standard hospital currently providing healthcare to residents in the municipality and also clients from the Republic of Togo. Even though the facility is currently the largest in the municipality, its needs are enormous. In July this year, SOSSAH and its partners have donated a large quantity of medical equipment to the facility, a kind described as the largest consignment to have received from a non-governmental organization in the history of the hospital. Few weeks after receiving the items, management and staff of the facility could not hold their joy.
There were issues with nebulizers. If we want to nebulize our children, we go out from the ward to borrow, which is not appropriate because this is a NICU we are managing, and children, neonates are not supposed to share items with other patients. So to prevent cross-infection, it is not ideal, but that is the situation we find ourselves. So it was very challenging though, but this is a situation. Before, we're having only one radiant warmer, which we were using, which was not adequate for the management or running of a NICU. Because when we have a lot of preterms, then it's difficult to manage because you can't combine two babies in one radiant warmer. We have always been preaching against cross-infection and neonatal infections and stuff. So it wasn't appropriate. So because of that, most of the preterms that we have were referred to either ABO or Volta Regional Hospital, currently HULETEY Hospital. The incubators we had were about 3, but one was not functioning. So we're forced to use only 2. And you could imagine if you have 3 or 4 cases, then it becomes a dilemma for the one on duty as to who should be in the incubator and who not to be. So what we do is that it's a preferential issue. The one who comes first, or prioritize the condition, and then the one we can refer through a distance from here to above, then we do that so that we will not complicate or cause infection to our patients, and also give a better and good care to our children. And also issues with oxygen. We do have a lot of birth asphyxias. The flow meter issue too has been a major problem, where we have only 2 flow meters, and now 2 children are already on a flow meter, and probably the 3rd person wouldn't get. So it has actually been a challenge, which we have been going around the world to look for a flow meter. Sometimes it's not available, so you have to invent a way of swapping a little bit to support this child and support the other one, and then probably finally refer the child to the appropriate facility that can take up the responsibility. And so the donation has really complemented our job, and I must be very frank that we are very, very happy and very grateful to the organization for this generous donation. Oxygen administration has reduced with the 2 flow meters we have, which are also having issue, but with the concentrators, it doesn't really need a flow meter to be able to administer oxygen to a neonate. So our problem in the side of oxygen administration has reduced drastically the situation of oxygen flow meters. We are actually grateful, and then our babies are also receiving the needed care that they are supposed to get. And with the help of the donation, we have about 5 incubators, which has also increased our intake, and so at least the referral level has reduced due to the number of equipments we have gotten. The radiant warmers are also very, very helpful to us, and I must be very frank that as it stands, we have about 3 currently, and we are maneuvering around it to be able to work around it. Currently too, we have a new nebulizer, which we are actually helping to nebulize our babies when needed. Each of the staff working here has actually been trained how to use them, so all of them are using the equipment appropriately and as needed. And I think the maintenance culture with the staff using the equipment are also on point, and so we are very, very grateful for the donation that we had, and I must be very frank that it's really, really helping our mothers, our babies, and ourselves as well.
Before, we were not having efficient and sufficient equipment to work with. Sufficient equipment in that we don't have enough to work with, and then efficient in that the ones that we have are weak. Most especially our delivery scissors were blunt, giving us issues, especially when you are giving episiotomy. Our weighing scale was only 1, so during delivery and postnatal clinics, we have to swing between the 2 clinics, which makes it very difficult for us to use. But with the new delivery weighing scale and the instrument, it has made work very easy. We were given a weighing scale, a delivery bed, vacuum extractor, fetal Doppler, pulse oximeter, and most importantly, delivery instruments. The equipment has come to us as a great relief, because at first we're not having a vacuum extractor, and so when somebody comes in labor and it gets to second stage, we are forced to take the person to theater to go in section instead of using the vacuum extractor. But with the vacuum extractor in place now, we use it for mothers that have maternal exhaustion in second stage, then they deliver per vaginum instead of going for cesarean section. We were also not having enough delivery bed. We have only 2, so when we have more than 2 people in labor, we are forced to deliver some of them on the normal lying-in beds, which is very uncomfortable for both the clients and the staff. So the 2 delivery beds also came as a great relief to us, because now we have delivery beds that mothers can deliver on safely. They can be positioned well to have a safe delivery. Our instruments have also come as a great relief, especially with the delivery scissors and the amnion hook, which is helping us and giving good episiotomy cuts for the mothers during second stage of labor. Fetal Doppler also come as a great relief, because without the fetal Doppler, we are forced to use the fetoscope, which is uncomfortable for both the staff and the mothers. But the fetal Doppler is easy to use, it's comfortable for both mother and the staff. So it has helped in our hourly monitoring of mothers that come in labor and mothers from 32 weeks and above that are on admission. We are grateful to our donors for the things that they've given to us, which has come as a great relief to the unit to help both clients and the mothers, and helping us to achieve our 0 maternal mortality. We are still appealing to them to help us with a CTG machine, which will help us to monitor fetal well-being when the mothers come, which will help us to know what is actually happening with the mothers to reduce our neonatal stillbirth rate.
This is an adjustable mobile OP lamp that was donated to us, and then it has been very helpful as at the time that it came. Formerly, we were using an OP lamp it becomes very difficult to adjust or to focus when we are doing EOU. But since this one came in, we're able to adjust it to the level at which the surgeon wants it to be for a good focus for that surgery, particularly the EOU. And then also with the one behind you, it produces a lot of heat whilst it is being used. But with this one, no heat seems to be emitted. So it has been very useful and very helpful for us whilst it is brought. The old one is very old. As you can, sometimes when you are using it, it goes off and on because it is battery charged in a way. But this is a new version of that. That is portable and then not heavy. The old one is very heavy and sometimes moving it around becomes very difficult. It's very heavy. So sometimes about 2 people or 3 people have to move it to its destination to be used. In comparison with the old one, this one is very easy to move. And then the focusing on the adjusting is very favorable. In a situation whereby you have to do an OP very low, you can adjust it and then focus your light on whatever thing that you wanted to do. But with the old one, you cannot adjust the stem or the stand so low as you want it, especially when the client is in a lithotomy position on the delivery bed or EOU bed. And then with the focus, you can rotate it at the angle that you need it. It can be rotated here and then even be turned around in all angles that you need it. But looking at the old one, this is the limit of its adjusting. It can only bend down and this is its focus. And then the moving, because it's heavy down there, it is not that easily movable. So it's heavy. This lamp is very useful because then our main OP lamp had spots, and then it came in also in the nick of time when we were having power crisis. With this, it is rechargeable, so when power is out, we still can use it, and then it's very bright. So it has been very, very helpful in times of power outages, and then in this time that our OP lamp is put. So as you can see, it is very bright, very, very bright, focusing on all the length of the bed. This particular lamp, I would say, is very useful. This machine is very much adorable because we have been having challenges with suction machine for a very long time. We have only one, and even that one, it comes on and off when it likes. So sometimes in the middle of surgery, you are forced to fetch the fluid coming out with your kidney dish. But when this came, it has been very, very helpful in that we have 3 beds in this theater, and then we use 2 at a time, and then one other bed also is there for emergency. So since we had one, it has been difficult in a way, but when this came, we could only say hallelujah, because it came to solve a problem that we have been looking for solution for some time now. And then its suction is very quiet and very smooth. It's very helpful. This monitor is also part of the items that was brought. And I could also say that in that time too, we were in dire need of monitors for the machine, because it was only one monitor that had been functioning then. So you have to carry it from one end to another, when we needed it. So this, I could just say the gadgets came in the nick of time when we needed it. Like the time that we were about to say help, then it just came like that, as if it was heaven sent. They have been very useful, I will say that. And they came at the appropriate time when we needed them all.
This is the ultrasound unit, and we are grateful to have received a new ultrasound system, much bigger and more equipped than what we have here. What we can do with this, the new one, that is helping with the old one, is we are able to do abdominal and pelvic. We didn't used to do here. And we have more clearer images. The images we get with the new one is very clear. We are able to predict the sex of fetus even when they are breech. At first, it wasn't really possible because of resolution problems with the old one. If we look at this machine right now, we can see a shadow here. That filtered a lot of our images that we had to work with. It filtered a lot. So if we form an image, we now have to spend a lot of time positioning the image to get a full circle, or let's say a line to measure for patient. So with this machine, we've saved a lot of time. Now we just get our images and straight away measure, and we are moving. We also have two machines that it will save us with some emergencies that are brought here all the way from maternity. So if we are to take this to maternity, they will be able to do emergencies there, which is for miscarriages and so forth. Then we can concentrate with the obstetrics, safe obstetrics, pelvic and abdominals here. So with the shadow here, it's interrupted with a lot of our work. When we get the abdomen of a baby, that's, for example, the abdomen of a baby, we would have to reposition it to let it come a bit fuller for us to take the measurement. Or if we take the femur of the fetus, we'd have to reposition it for some time before we take the measurement, which interrupted with our work. We are at the moment still using this because we want to get a stabilizer for the new one. As we have power fluctuations here, we are planning to get a stabilizer for the big one before we start using it.
I might say I'm very glad when we receive equipment from its ANIMEC and the health group. As soon as the equipment were received, they were received into our books. A need assessment was done to get the various departments and the user agencies that needed it most. After labeling and numbering them, they were shared into the units that needed them. And I might say my nurses, doctors, all staff were very happy when the equipment landed on a truck. All staff helped offloading. It was a nice scene. And I'll say we were happy. For now, it will really help us in our healthcare delivery. The facility is more or less a referral center because it is the biggest hospital you can find in this district. So we normally have referrals from sister facilities. People come assemble from Togo and Benin for our orthopedic services. In fact, I would say for the NICU, mothers are happy. The nurse specialists are happy. And for the theater, autoclave and others that were given to them, they were all happy, thanking ANIMEC and the hair group. And in fact, already we have a unit, clinical engineering department that consists of 3 staff, duly qualified. We have training section and orientation that is done periodically. Monthly We do have in-house service training and on-the-job training for staff. Therefore, the equipment, I will say, they are going to be put into good use. Just as someone will say, we need more to do more. If Edimiak and his group happen to get more for us, it will enhance our healthcare delivery. And in fact, it will have an impact on the citizenry in this vicinity and beyond. And I will say, although they are our friends in the diaspora, they are adding very much to the healthcare delivery of our people. There is nothing we can say that we give them thumbs up. Congratulations to her group for all that they are doing. We are in expectant mode that anything given to us will be put into the intended good use. And come one day when they visit the facility, they'll be very happy seeing the equipment that they have sent to us helping in healthcare delivery. Just as they send more, we shall do more.
Previously, we had 2 incubators that were not really functioning properly, and fetal Dopplers that were not so good because I think in Ghana we don't have the very quality ones to buy, so we buy them in a few weeks to months, then it doesn't function properly. So we had a lot of challenge with our equipment, incubators, fetal Dopplers, and the rest. Some of our delivery beds are not in good condition. So as these ones came, it's a great joy to all of us. We are so much excited about it. I just want to use this opportunity to express our profound gratitude and excitement on the equipment donated by SOSSAH. We are so much appreciative of it. It came at the right time because there are things we are in dire need of, and we can't hide our joy. We are so much grateful. We are so much excited about it. So I just want to use this opportunity on behalf of my nurses and midwives and our clients to say a very big thank you to the organization. We pray that the good Lord will continue to provide for you so that you can also in turn donate more to us. We are grateful.
These are needs which are being satisfied by a group of benefactors, and so we're grateful. But we became more excited when we got to know the source, the person who coordinated all that from Europe, Holland in particular, knowing that the lady is a daughter of the first doctor of St. Anthony's Hospital, Dzodze, and that the lady herself was born at that hospital, made us more excited that, oh, the link is still there, though the doctor, we call him Dr. Kojoga, in those days they call him Dr. Kojoga, is gone, but his services is still living, and this is a great memorable legacy that the daughter has instituted to have that link going. You know, for us it was a wonderful experience. Their needs, and they are going to go a long way to help children who are sick and who need more healthy life to lead, their mothers, their fathers, and so forth. The hospital is now being noted very much for orthopedic care, and so those items, when you go to the orthopedic care system, will be very, very, very useful. So we're just, it's just like a miracle coming our way. So we're so grateful, so excited about it. Yeah. I'd like to reassure them that their effort, their sacrifices in putting all these things together as medical supplies, medical equipment for the hospital is very much appreciated. It will be judiciously used. We'll try to do good maintenance for what must be maintained. And we would like them to come from time to time to see the fruits of their efforts. And we would like this link to go on. When we have our needs, we can just send it to them, and what they can do about it, we'll be very grateful about that. And if they can spread the news abroad, I mean, wider, and they know that this is about health care. It's about health care. We are living in a rural community taking care of a lot of people. In fact, some even crossing the border from Togo to Ghana here. We don't discriminate because you're Togolese or Ghanaian. We only know that you are a client in need of medical attention. It's a Catholic hospital, but we don't ask you whether you are this or that religion. No. Gender, we don't have any problem. And so with that, we expect that people over there who are also helping and contributing and so forth know that whatever you do is serving everybody who is in need of health care and comes to St. Anthony's Hospital for such care.
We really appreciate the efforts of our donors. I mean, it takes a special type of person to really see what we need and have a heart to work hard towards getting all these items for us. We really appreciate your efforts. I'm sure you've seen from the staff and the patients how happy and how grateful they are and the impact it has made on our work. The next project we really need to work on is standby generator power for the hospital. The current generator we have is very old, and currently we have problems with starting it when the light goes off. And this leads to interruptions in surgeries sometimes. One of the donated items was a rechargeable lamp, which has come in very useful because sometimes we are doing operations or surgeries and the light goes off, and we depend on that rechargeable operation lamp until the light comes on. We have a lot of equipment in the hospital now. Without reliable supply of electricity, this equipment can be damaged. So we are really looking forward to replacing our current generator. The other need we have right now is transport. We don't have an ambulance for the hospital. Sometimes there are pregnant women or patients who need urgent care at a higher level of care or more specialized care, but without a reliable ambulance, we are unable to help those patients, and sometimes it leads to delays in treatment, and sometimes there are complications. So these are the next couple of projects we really want to work on for the hospital. We would like to thank SOSSAH especially for this donation. We would like to thank Animique. We know you have a great heart for this hospital and for the people of Dzodze. We want to thank the Rotary Club, who has also assisted in getting these items for us, and all your friends and individuals throughout the world who have contributed to helping St. Anthony's Hospital. We would like to thank you and say Akpe, and God bless you.
SOSSAH is a Dutch short abbreviation for Foundation Mutual Collaboration St. Anthony Hospital, Dzodze in the Volta region, Ghana, that collaborates in its own way to provide support to the St. Anthony Hospital and the vulnerable communities around the hospital. Animique and Caroline, whose dad happens to be the first doctor at the St. Anthony Hospital, that's Kojoga First Debrekery and the Madam Mavi Debrekery, and myself were the initiator of SOSSAH. A few weeks back, SOSSAH will engage in Rotary Club, Rosanda Dockland, Medic Foundation have equipped the Neonetal Intensive Care Unit with ultramodern equipment, maternity ward, theater, laboratory, as well as assisting or supporting the public health department in their health outreach program. During this pandemic, SOSSAH has supported the health outreach program, in which over thousands reusable face masks, carbolic soap, hand sanitizers were donated to the various schools in the Keta-Akatsi district as well as the community to aid in combating COVID-19. SOSSAH has also enrolled the community members on the National Health Insurance Scheme, just to mention few. In a nutshell, SOSSAH has been helpful to the St. Anthony Hospital since its existence, and I'm very grateful to SOSSAH. I would like to extend my special appreciation to the board members, of SOSSAH in Ghana and outside Ghana. I would also like to thank our administrator, Mr. Tumau Raffle, for his immense contribution to SOSSAH. I'm also grateful to the Director, Keta-Akatsi Diocese, Lieutenant Colonel, retired WKD Straha, our former Director of Keta-Akatsi Diocese, Mr. Koto Brown, not forgetting Prophet Binka, Margaret Adanu, David Amagachi, Iram Bevel, Evans Che, Evans Bosodia, Nelson Awudi, Marian Opansu, my dad Godfred Christ, our nurse manager patient SEGBEDZI, Wisdom Ahama, and of course the one who always do the documentary for us, Mr. Akpabliao, for the advice and words of encouragement which has equipped me to embark on any project I wanted to. The entire staff of St. Anthony Hospital, the public health unit, as well as the ART unit, I'm very grateful to everyone. Just like Oliver Twist, we still need support. Our biggest challenge or need at the facility now is a standby generator to support the electricity supply anytime there is a power outage.